And we thank you for staying with us. The New York State Academy of General Dentistry has a mission to serve the needs of dentists and promote oral health to the public. And joining us now with oral health tips and more, more information, are Dr. Ira Levine and Dr. Lawrence Bailey from the New York State Academy of General Dentistry. And we welcome you both to the show.
Thank you.
Thank you very much.
Thank you. So everybody always talks about taking care of their body, right? And that's major, but also taking care of your mouth is definitely paramount. And there's a lot of people who, when it comes to taking care of their mouth, really fall short. But give us a little bit about the importance of oral care.
Taking care of your mouth is extremely important for all general health, not just oral health. It is linked, gum disease is linked with heart disease, it's linked with strokes, it's linked with oral cancers, it's linked with a lot of different items which are not related to the teeth as well. But taking care of the teeth is really important because you want the teeth to last for a lifetime, and doing so is critical.
Mm-hmm. You know, and the mouth is the gateway to the body, overall oral health. And so with young children and especially athletes nowadays, prevention is the key. Mm-hmm. You know, you want children to use a mouth guard even when riding a bike, when playing sports, brushing your teeth. Make sure you use a soft bristle toothbrush, pea-sized amount of toothpaste, that's fluoride, and a mouth rinse. That's either anti-gingivitis or antibacterial. And it's not just for the breath, it's to help get rid of bacteria that can lead to gingivitis and dental cavities.
Yeah, I think sometimes people walk away and say, listen, I brush my teeth, I'm good, right? Mm-hmm. But then there's that mouthwash component. And, yes. and there are some real positive effects for really using mouthwash.
Mm-hmm. Proper oral health care, along with regular dental visits, is a key to prevention. And that's what we're really talking about, is prevention, because once you start developing pain and problems, then it's usually too late. Mm-hmm. And you've developed serious issues which need serious care. There are predisposing factors. Some are genetics, some are habits like smoking, some are things like diabetes, immunological problems, and medications, because 80% of all medications cause dry mouth as a side effect. Mm-hmm. Stress is a big factor in terms of oral health as well.
I'll ask this question. A lot of people who have had this conversation talk about, after I'm done brushing, I'm brushed, I've used the mouthwash. Let's talk about that word floss, right? How important is that?
Flossing is extremely important because, you know, the toothbrush is pretty large and it just covers a wide area, but a floss gets in between the teeth. So if your two teeth are just opposed to next to each other, the floss gets in between, something that the toothbrush can't do. And, you know, that's a hiding place for bacteria to start cavities that, you know, if an untrained eye looks in the mouth, they won't see that cavity that's in between those two teeth. So flossing is important, at least once a day.
Right. So we got brushing, we've got rinsing, we've got flossing.
Yes.
Absolutely.
All three are very important. Now, got to ask you the question. Most people, right, when it comes to doctor visits, sometimes we're not so prone to go to the doctor. Mm-hmm. People say when it comes to the dentist, it's even worse. How often should a person actually come and see you?
In general, we talk about 6-month visits. And at that time, we do a full exam. We look at the head and the neck. We look at the teeth. We look at restorations that are present to make sure they're in good shape. Look at the gums. And some people do require more frequent visits, and it depends upon what sort of problems that they have.
Mm-hmm. And you know, and I was just going to add to that, and again, prevention,
right,
and or early diagnosis, which leads to talk about oral cancer. You know, I already had talked about smoking and alcohol, and as during the examination, a dentist will look in areas that you just won't see. The trained person won't, the untrained eye can't see, and we'll pull the tongue out, we'll look underneath the tongue, we'll palpate, we'll feel the around the glands and the neck, head area, to find certain early detections of possible oral cancer, which can be very debilitating and painful.
Right. And give me this, children, right? We got children who are out there. We talked about going to see you at least once every 6 months. How important is it and how often should children actually be before you?
Children should start seeing a dentist at about 1 year old or 6 months after the first tooth erupts. Prevention also is a key for children. Yes, they are baby teeth, but they do need to serve a purpose, which is holding the space for the adult teeth as well as proper development. So you want to watch also in terms of pacifier use and finger sucking and things like that. And try to have the child stop that before the first adult tooth erupts. That will interfere with proper facial development, sinuses, and will cause misalignment of teeth.
And the other thing, one of the problems that affect our community, in the Bronx community here, is baby bottle syndrome, toothbrush, where the parent might put a child to sleep with a milk bottle. And that's one of the worst things that can be done, because all throughout the night, those teeth are being bathed by the sugars from the milk, and the acids start erosion. So, even though we have the fluoride, and we have other modalities to prevent decay, you really can't do much if a child is just teeth are bathed with milk night after night after night. And we do see a lot of baby bottle syndrome cases.
In general, the only time that the child should have milk or juice or sports drinks is with meals. Other than that, it really should be just water.
Just water.
Just water.
Just water.
Just water.
Wow, that's
Just
pretty.
water.
That's pretty interesting. When it comes to toothpaste, right? We're not trying to give a commercial, but there's so many things you see out there on the market, right? What should a person be looking for in particular toothpaste to know they've got the right kind of toothpaste? And if you want to say a name, you're more than welcome. But I just wasn't going to endorse anybody.
Well, again, we're not here to endorse anyone,
Right.
or even the American Dental Association, which we are separate and distinct from them.
Right.
But a fluoride-based toothpaste, which carries the ADA seal of approval, is a good starting point.
Okay.
Because one, it has a fluoride, and two, it's not abrasive. A lot of those toothpastes out there, people think if it feels like sand, it must be good, but that's far from the truth.
We see some things that are happening, such as recommending the use of coal dust and oils. All those things are so bad. They contain glass particles and all kinds of things that can damage the teeth. And so, not a good idea.
Yeah, and that's the reason why I brought it up. I didn't want to go into particular names, but I know because I just 2 days ago I was at Walmart and had the opportunity to see people. They were going back and forth about which one was right, which one was wrong, and they were talking about there's some extra stuff that comes when it looks like one thing, but it really isn't.
That's right. As well as injuring the teeth, it can also injure the soft tissue, the gum. So again, it's soft bristle, very soft, ultra soft bristle toothbrush, fluoride-based toothpaste, and floss.
And floss.
That's
it.
Floss, yes.
So you got to brush, you got to floss, you got to rinse, you got to see once every 6 months. Is that for adults, right?
Yes.
And
children.
And children, once every 6 months, right? So then we've done a good job on this segment. We've educated, right?
Yes, indeed.
I believe so.
Sure have.
So that means you got to come back again, all right?
We're willing to.
All right, thank you so
Thank
much.
you so much.
We appreciate
Okay.
the opportunity.
No,
Yeah.
we appreciate the
Thank you.
education and the awareness. I mean, sometimes we take this stuff for granted and we
We
laugh
do.
about it, but it's very real. And a lot of people have been adversely affected. So thank you for the awareness that you
Thank
give.
you.
No,
Thank
thank
you.
you. All right, listen now. Again, do not forget to visit your local dentist. Now, if you want more resources, if you want more information, visit the New York State Academy of General Dentistry at nysagd.org. Once again, that's nysagd.org. Or you can pick up the phone and call 718-747-3353. Don't go anywhere. We've got more open coming up right after this.